I'm Eric Pierce, publisher with BioCentury. BioCentury is a proud sponsor of the Galien Forum and the Pre-Galien USA Awards Ceremony. I'm here with Joel Marcus. He's the founder, CEO of Alexandria Real Estate Equities, which also is hosting this lovely forum. Joel, welcome, and thank you for joining us.
Pleasure to be here.
So
I have a long history with BioCentury.
Absolutely, yes. I think you were part of our original editorial advisory board.
I was.
Yeah. Well, thank you for joining us.
Pleasure.
I want to talk to you a little bit about the word ecosystem. It may be an overused term these days, but you are one of the people that really helped foster the ecosystem and the clustering of innovation. So, in bringing together and sort of the networked knowledge. Describe a little bit about how you think about the clustering and also how Alexandria is trying to advance the life sciences with your mission.
Well, I think most industries are not necessarily highly collaborative. If you're in the auto industry, you generally don't collaborate with your competitor. But in the biotech, life science world, it's a very collaborative ecosystem, and companies are highly collaborative together. And I think that's the one very distinguishing factor that is unique about this industry. Mm-hmm. Even technology industries, Google isn't collaborating with Apple very often, right? Mm-hmm. And so here it's very unique and different. And early on we realized that really the secret sauce to being successful in this industry, and I go way back to the days of Amgen and Genentech, is to foster that collaboration, which leads to innovation and obviously new product development to solve the two biggest issues we have, which is disease and hunger, outside of politics and war. And so we try to do everything we can through our various modes, both infrastructure and thought leadership, to bring the ecosystem together.
Yeah, we had Michal Sadelain from Memorial Sloan on, and we were talking about collaborative ventures between academics, corporates, and he brought up the IP issue, and that still can be the big 800-pound gorilla in some of these discussions. How has Alexandria's built their network and their facilities to have an open door policy as opposed to something that might be a little bit maybe seen as maybe opening the kimono too much in terms of trade secrets and IP?
Yeah, well, I think the industry's come a long way over the last decade. The industry actually, both at the governmental or quasi-governmental level and at the commercial level, have really embraced the notion of pre-competitive collaborations. Many industries wouldn't even imagine that. But data sharing, the ability to do things together, to put the companies or institutes in a position to pursue their own IP positions and so forth, is now very common. I sit on the board of the Foundation for the NIH. They have a number of major pre-competitive situations. I also sit on the board of Multiple Myeloma Foundation. They have really become the poster child for pre-competitive collaborations with respective patient populations in the myeloma area. So it's actually very common now to have both companies together and the ecosystem broadly working in the pre-competitive space.
You also have a ventures group. Why don't you talk a little bit about what you're trying to accomplish with that, and what sort of strategic operatives that gets Alexandria?
Yeah, so my prior life, I spent a lot of time in the venture capital industry, and today we have over $400 million on balance sheet. So we spend a lot of time in that world, and part of the reason we do that is one of the main drivers is leading edge knowledge of where the science is going, because we feel we're not as good a stewards of capital if we don't understand where the latest science is really going, and much like trending on Twitter, right? And so we've built I think a real powerhouse force in that area, and have done very well. We've had, over the last 2 years, I think we've had north of 24 exits, either by IPO or M&A, among the highest of any venture firm out there in the biotech arena. So we're very proud of that.
Yeah, and is that a financially driven?
It is.
As opposed to strategic from a...
Well, it's both. It's strategic in the sense of the detailed knowledge of leading edge technologies, and financially driven because we want to make good money, and we've done very well. Most of our investments, 85%, are in non-clients, so that's not such a driver for us.
Right, right. So just switching gears a little bit, I have to ask you about the election coming up.
What election?
There's an election? I wanted to just get your take on, because clearly there's a lot of pressure and a lot of discussion around drug pricing.
Yes.
And depending on who gets into office, that pressure is probably going to increase. What can the industry do to soften that, to soften the noise around drug pricing?
Yeah, so I would say two things. We just held a summit on healthcare economics recently and brought together all the top stakeholders. I think it's fair to say that drugs today make up about 10 to 15% of total healthcare costs. And you see what's happened with Obamacare, the Affordable Care Act, the premiums are kind of skyrocketing. So I think drug issues are a piece of it, but certainly not the major piece. I think overall healthcare costs are what's really important. And so by bringing together the various stakeholders, insurance companies, middlemen, obviously the drug industry, government, and policy people, to really look at the system is what's needed. For example, if I'm an insurer today and I have the choice between paying for a cure for you or paying for a year of treatment for you at a far less cost, I'm going to probably make the decision maybe to go for a treatment because you might not be I might not be insuring you next year. So there's the way we do payments and the way we insure risk, I think, has to change. We have to take a long-term view. The government has to be a player and a facilitator, but not a bar to the entry. I'd also say primarily that some of the drug issues that have emerged have been by primarily non-R&D driven companies, which is unfortunate. I think the research driven companies have been, by and large, done a very good job of being responsible in their pricing. But I also do think that the politics of what's happening now should focus on two things, really. One is bringing the constituents together to come up with a rational approach. I think none of us want government health care alone, because that would be like going to the VA system and waiting in line for
Stand in line.
It's not a good system. Or the suicide line, 1/3 of the calls of the suicide line aren't answered. That's not a good answer to the healthcare system. But I think the government, and there is a bill in Congress right now, which we hope will pass 21st Century Cures, to fund further more the National Institutes of Health. And I think bipartisan, neither party's opposed to that. They're just trying to figure out, is it an entitlement or an annual appropriation, and full funding for the FDA so regulatory science can lead the evolution of drugs. But I do think everything's collaborative and cooperative, and it doesn't make a lot of sense to point out one group or one company or one constituency that somehow is causing all the ills. I think we've got to do it as a collective body. And whether Trump or Clinton gets in, I think it's the policymakers, hopefully, that will bring rational thinking to the forefront. I think the bully pulpit is not the way to go here.
Yeah, right. Joel, thank you very much, and thanks for hosting us as well.
Pleasure, great pleasure.